Happy Wednesday. Welcome to all of you for our daily Natural Health News live show, where I report to you Corona surge news and other information, research, journals, and articles specific to more understanding about COVID and its impact on your bodies. So I am very excited to have you join me today. If you do me a favor, for all of you new, if you're watching for the first time, hit the join, subscribe button on YouTube and here on Instagram. I'm Dr. Melissa Gallagher. I'm a naturopathic physician, and every day for now over 110 episodes, I bring you a whole bunch of news. So today I'm going to share with you some brain scans because we're seeing more brain damage. And we've got a new journal out of the UK in the Journal of Brain, or Journal for Brains, that I'm going to report on, as well as a whole bunch of information about some petri dishing related to mask and non-mask wearing. So we have some more science and data on that. And for all of you tuning in, let me know where you're coming in and tuning in from and watching. We do have a large international community. I always love to see where you guys are all joining us. And for Carolyn in San Francisco, thanks for waking up so early. I appreciate it. Hit that like button to help us get our message out there here to keep everybody healthy and safe. So let's dig into our news today. And for all of you, just a quick little recap. The beginning of our show, I go through news. If you don't like the news, you can fast forward and you can get to the gist of what we're going to talk about brain health and nootropics, brain supplementation, things like that, to circumvent any possible risk and to really bolster and fortify your brain health. It's never a bad idea to support our brain health, regardless if you have had COVID, are potentially at risk, or concerned you might have had it. This will help minimize any of the neurological and brain-related disorders that occur later in age. So stick around for sure. This will be impactful. All right. So the U.S. Just hit 3 million cases. So we are charting it's insane, the growth that we've had. The U.S. is at 11, or the world is at 11.7 million cases. By the end of the weekend will probably see us worldwide move into 12 million cases. And just as far as some noteworthy information here in the U.S., we have seen two states have double-digit positive cases show up yesterday on their caseload. So this is definitely, we have some epicenters here in the U.S. I do want to make a note, follow up to yesterday, the anti-masking COVID denier president of Brazil, who they are the second epicenter, the epicenter in Latin America. Brazil is at 1.67 million cases, and the president had indicated that he felt symptomatic and had undergone an MRI. Supposedly an MRI showed no sort of damage. CT scans are obviously the most impactful for lungs, so I'm not quite sure why MRI, but at any rate, he did test positive. So the Brazilian president has become infected with COVID, and there's some disturbing images of him being too close to reporters and public and children and things like that. So I just think that'll be something we'll follow, but it is indicative when we have administrations across the world coming down with this. This is affecting all people, all levels in our society, and it is a highly contagious contagion. This is both particle-based droplets, coughing and sneezing, talking, singing, but we also see it's aerosolized. And this is something that scientists are trying to encourage. The World Health Organization, which was very lagging on their information, we obviously have to kind of consider our source. So they were not necessarily the best in terms of speed of acknowledging new advancements and new understanding about this. But we do have a novel virus. And so I just want to communicate, we have to have some expectations that we're not going to know everything immediately. And that is also for the COVID deniers and the anti-maskers. There's more information coming out every day, which I'll report today. Noteworthy here in the U.S., California, they're at 277,000 cases. And you guys, for my California viewers, you had 10,201 cases. Hi, buddy. Oh my gosh, did you drink all of that? Will you go ask Daddy if he'll fill you up? You want to say hi to everybody? You want to tell him, what are you drinking? What are you drinking? He's drinking his nut yogurt milk. Will you close the door, sweetheart? All right, Brian is at home. It's just FYI, I might have some more visits from Gabriel. But okay, so California, they hit the capacity where they have gone beyond contact tracing capacity just for yesterday. They have a total of 10,000 disease detectives or contact tracers. They call them disease detectors there, but there will be some lacking or minimizing of the capacity because they've just exceeded the quantity of work that the contact tracers have, which is a very big concern. If we want to lower the spread, we've got to have contact tracing. We also have to have isolation, quarantining, and things like that. Yes, that's okay. Hold on. Let's see. I don't know. Here it is. Sorry, you guys. Welcome to my working from home world. He's so excited. Here you go. Okay, please go close the door, honey. Okay. All right. All right. So, so California, I do want to highlight that California, I don't have any news about the principals who all gathered to determine what was going to happen with the school system reopening that have been exposed to COVID and are in lockdown, quarantine. But California is definitely seeing some increases. And there's also some rolling back of some of the reopening guidelines. I know San Francisco Bay is having some of those elements at play. Now, Florida had not their biggest day, but they had 7,361 cases that came back positive yesterday. They have 56 ICU beds or ICU units in different hospitals that are at capacity. They, in 1 week, have posted 67,000 positive cases. So they're at 213,000. So in just 7 days, they increased by 67,000 cases. That's a lot, considering that their positive, the positive test percentage is 19%. So essentially 1 out of every 5 individuals who gets a test is going to test positive, which is not a good sign. And there are 16.4 thousand individuals who are hospitalized alone in Florida. And the other challenge is that the state is not releasing hospitalization rates. So we don't, other than what we kind of are gathering, we don't have solid quantifiable information. It's challenging also for some of the epidemiologists in the area to understand just how severe potentially Florida is. But Florida is the hot spot right now of what's happening in COVID. On Florida, I'll talk a little bit more about them in a little bit, but I want to move on to Texas. Texas set a record. I know I have a lot of followers in Texas. You guys have surpassed 10,000 positive cases yesterday. And the city of Laredo is clamping down on individuals who skirt contact tracers. They are going to subpoena them to gather information. They're going to be finding them. And then also they are going to be charging individuals who, once you get contact traced, you get, encouraged to have a test. You have to go into a voluntary quarantine. And a lot of these individuals are not voluntarily quarantining, which means they're actively spreading the virus. And so they have decided that they're going to charge those individuals for a Class A misdemeanor. Not exactly sure what that means in terms of either there's a cost to it or maybe jail time, whatnot. But Laredo is taking this very seriously. And they're one of the first cities in Texas that I have read about that is actually going to be mandating or taking legal action. We heard a little bit about the contact tracer in Maryland, or the individual that's skirting contact tracing, and they got a subpoena out, and he's going to owe like $2,000 every day for every day that he refuses to communicate who might be at risk. So New Jersey, just on the little front of that state, they're pretty much stabilized. They've had a few increases. Like yesterday, they went from 173 to 175. So 2,000 cases is a lot more than we would want to see up there. But the state, there's been a lawsuit by AMC, Regal, and another movie theater company. They're suing New Jersey to reopen. We might be seeing a big shift in terms of just our viewing of movies. Like we watched Hamilton, or I watched it. I watched it over the weekend through Disney Plus, and we've rented some movies that might actually come out in theater. So there's definitely a shift, and I think the movie theaters are freaking out a little bit about that, and that's where we're seeing that. Arizona, I want to talk to you guys about Arizona. They had a substantial day yesterday, considering they didn't have one of their biggest days of positive cases. It was 3,653 positive cases that came back, but from 2 weeks ago. So we started to see the acceleration in Arizona 2 weeks ago. The fatalities usually follow 2 weeks after the fact of these positive cases. And they had 117 deaths yesterday. So this is the telling note. We might be seeing this in a week and a half, 2 weeks in Florida. We might also be seeing this come around next week in Dallas or Houston and Texas and those areas. But that is going to be critical in terms of, these fatalities are from cases from 2 weeks ago. And I also want to make a note for any of you who live in Phoenix. Apparently, Phoenix does not have a health department. They have a county-oriented health department, but apparently it's not substantial. And so they're actually calling in employees of the municipal employees, like librarians and park workers, are now going to be trained. They're going to be doing testing. Can you imagine being a librarian? Like you're kind of maybe an introvert, you love books, hanging out in a library, and all of a sudden you are going to be donning PPE and in total close proximity to people who have probably not been wearing masks, have not been adhering to guidelines, and have been exposed or are contagious. So that is a big issue to do in Phoenix. Also here in Georgia, we surpassed 100,000 cases. So we have 101,000 cases. Yesterday, Gabriel and I took a little adventure out. We drove around. He and I drove by our city hall, it wasn't drive-through like cars, but they had people parked. And then, of course, they had people all gathered outside. But there are at least 150 to 200 individuals lined up to take tests, COVID testing. So that is not a good sign for our area. And I think we're going to see a lot of folks. And Lori said, our library just opened up for book pickup. No one allowed in. Yeah, libraries are definitely a no-go. So also on the note, I want to highlight Florida. Florida's governor signed an executive order that is rocking a lot of parents, teachers, a lot of my friends that are in the teaching world at home, with an executive order to reopen the brick and mortar schools 5 days a week, which is definitely going to be a concern in that there's not that virtual option. So it changes a little bit about how people are rethinking, especially teachers. I have a feeling we might see a mass exodus of teachers who are at risk, not coming back into the classrooms, which is going to pose an even bigger problem. Disney is reopening as planned on the 11th. So next week, Disney is going to be reopening. There have been no sort of deviation or plans to deviate from that. So we'll just have to see. I do want to highlight a fatality. The 17-year-old I had mentioned in Miami, it actually was a 17-year-old from Fort Myers, Florida, who had died from COVID. And turns out that we have more about her case. Her parents are both healthcare professionals. She was exposed by going to a church program. There were 100 students that were in some sort of church camp or gathering. And there was no encouraged social distancing, but no mask requirements for all of the minors. And she, at least we know, she's one of the cases from that situation. Her mom is a nurse and her dad is a physician's assistant. And they basically treated her at home, which is kind of like the telling of the sequencing of the situation is just kind of mind-blowing from a professional medical perspective. But she was at home. She spiked a fever. The dad felt that she had a sinus infection. So he got a script for a Z-Pack. She got a Z-Pack. And then her mom notated that she had a gray color to her. So she started to take her oxygen levels and they were at 30%. And instead of taking their child to the hospital, they grabbed a grandfather's oxygen machine and proceeded to give her oxygen. Then her dad, the PA, wrote a script for hydroxychloroquine, and she took that. And then within a day or two, her situation worsened, and they actually took her to a local hospital that transferred her to Miami-Dade, the children's hospital there. And that is where she expired. That is pretty insane. And, I don't advise anybody, just to get this out here, if you have any indication, especially your children, it is best to monitor. And I think I have some of my monitoring tools around here. Maybe not, maybe grab Gabriel. Sometimes he'll grab my stuff. It's a good idea to have, like, I have it over here. Let me grab it for you. I'll show you. I have a pulse ox. This is going to be critical. And so the fact that her parents were not monitoring this straight out is concerning. But, this is going to be the tool that you'll use for you or your family members, pulse ox, to evaluate how well they're breathing. And that is when you immediately need to go into action. There's nothing over the counter that's been proven. That includes herbs, vitamins, supplementation to calm, to therapeutically treat this. We have a novel virus, and we're in clinical trials with some of these medications, the steroids and the anti-inflammatories, but we don't have anything yet that is definitive as a treatment plan. And the fact that they did this at home, I have a feeling there's going to be more investigation about this. But I just want to highlight that because it's indicative that we have to take action immediately. And also, as parents, we're the adults, they're the minors, even when they're 17. We need to encourage them, and families, every family has to make a decision, but there's a risk factor. If your child goes to a camp, summer camp, soccer games, baseball games, there's a risk. You need to be aware of that. And if you're willing to have your child's life be at risk, that is a family decision. But, I guarantee they're wishing that they had sent their child with a mask, or even kept her home from that event. And it's a horrible thing after the fact to wish you did something differently. And no parent should have to bury their child. So that's my little PSA, but I wanted to communicate that. You might hear a little bit about it. I wanted to give you a little bit more background into that situation. And speaking of the impact of this virus, there's more that we're learning. And actually, this is coming out of Baylor Medical, the medical school in Baylor. So a Texas medical professor has indicated and wrote more information about the overall disabilities that COVID will yield. So right now, the big argument for the anti-maskers, the COVID deniers, this is just the flu, not everybody's dying. The major argument that they're making right now is that asymptomatic carriers, there's nothing wrong with them. There's no long-term issues. It's just a minor, case of sneezes and breathing problems. But that's actually not proving to be true. And in fact, this professor has indicated we're going to have a whole entire generation of disabled individuals because of this. And he breaks out all the different disabilities that harken back to COVID as its source. Lung injuries, heart-related injuries like damage to the heart, damage to the vessels, the valves, cardiovascular injury, that's big time in the blood clotting, just a strain on the actual viscosity, the strength of the veins themselves, neurologic injuries, decrease of muscle mass, kidney and digestive issues. These are what we're seeing as long-term. And granted, long-term is now 7 months, 8 months of this. We're still new in this. This could be something that we see longer. We see this even greater. Nervous system problems and cognitive challenges. And those are things that can greatly impair individuals. So even asymptomatic cases, when we CT scan them, they have the cloudy lower lung damage, scarring. And the scarring is what is causing the scar restructuring of the lungs, is what's causing the lingering barking, hacking cough that people just can't kick. And that scar tissue that is restructuring in the lungs. And that's a really hard thing for folks to get over, but there's long-term impact. And with that being said, I want to share, actually, before I go into the data, I want to share this. Okay. So I want to share with you, there is a doctor, Dr. Richard Davis out of Providence Sacred Heart Medical Center. He did a scientific analysis using Petri dishes and culturing bacteria. Right now it's bacteria, but it's just indicative of how successful masking is. He's wearing, it appears as though he is wearing, he is wearing a surgical mask. So this is a lot stronger than that. The cloth ones, they're all very much, we now know there's 4 kind of masks, like one sneeze with a mask, without a mask. And this is the bacteria cultures. Then singing. So singing has some spread. And he's saying, so one sneeze, singing for 1 minute. This is talking for 1 minute. Actually, talking looks like it might be a little bit more than singing. And then this is 2 coughs. So we know you get the speed, the air volume has been tested. I've reported that like you cough at like 55 miles an hour. Like that's what a cough, the the expelling of particles, phlegm, mucus. That is 2 coughs without a mask and with a mask. And this, he shows what this looks like. And this gets a little bit more intense. He also did it where, so he's got it, at a certain level, and he's coughing at it. Then he also lined up Petri dishes on a table, and it was like 1 foot, 3 feet, 6 feet, 12 feet. And he did the same. And you could see with or without a mask, just how much that had spread. So I thought this was really impactful. It's posted on the website, but I will make sure I share this on my Instagram stories. For anybody, again, who's concerned about, wearing masks, there are a lot of options, and I presented them down below so you can grab them. I'm a big proponent of the face shields plus a mask, and this is a cone-shaped mask. I have one vendor that they're giving us 10% off of these, so that is linked down below. The most effective, what they've seen in the studies, are these. These are handmade, sewn, double layer, thick, multiple thread count, adjustable nose, and you can tie, which gives you adjustment to cinch in down below and get more cinch for different faces. We have heart, oval, circle, square. We have all different types of faces. And sometimes these masks don't fit you well, but this is something that one of my friends is making. So we're going to start up. Oh, it looks like YouTube's buffering. Darn it. Okay, so we're going to start getting Gabriel trained on wearing a mask. This is one of his little kiddo masks. And this is something all parents who have kids possibly going into school. And also, these I actually grabbed these on YouTube, or not YouTube, on Amazon. They have a little kids mask. These are like the little circle ones, different colors. And they also have a little pattern here, like this. But these are things that it's a good idea now to start with your children, especially like the younger ones. So this is a little mask for Gabriel. It's cute. Like it has a little person on it. This is the kind of thing you would see at a hospital. So we need to start getting our kids used to this, because the likelihood of many of them going into school is going to be great. Likelihood of them going into doctor's offices and routine visits. You want to start to get your child used to mask wearing. Similarly, for any of you who are staying at home and are a little uncomfortable, do some regular activities where you're wearing this so you get a little bit comfortable, and try out different types. Not one mask is going to be a solution for everybody, but you'll find what you feel most comfortable with. I like this as a double layer. So you can put this over your head, and then you can wear a mask. And even just this alone is more protection, and it provides protection on the sides. It's not great in terms of there's a lot of stuff that will come out. So if you want to protect other people, you put a mask on. So definitely there's links down below to that. But what I want to highlight today is the research that came out. There is, there's a whole bunch of brain-related scans that have come out with a journal article. And I'll show you, these are some disease brains from COVID. So these are scans of the brains, the brain, lung scans, and you can kind of see the impact with the brain. And more brain related scans. What they're showing, and I'll share with you this. I'll post this link down below. This is a research article, came out, published by Oxford. It's in the brain, like the journal, like brain journal. It's called The Emerging Spectrum of COVID Neurology, Clinical, Radiological, and Laboratory Findings. So they are breaking out everything that we need to know about the brain and neurological disorders and challenges with COVID. They pull in a lot of different authors. They have a Dementia Research Institute that's a part of this. Their National Hospital for Neurology and Neurosurgery with the University College London Hospitals. UCL, which is the Department of Physiology. University of Oxford in the Neuroscience Department. And what they identify, so let me share with you kind of the synopsis of this article. It's a whole bunch of UK neurologists that come together, and they look at 40 different patients. And they look at some of the brain neuro-related complications, and they start to identify that there's an underlying thread, and it's abbreviated ADEM. It's acute demyelinating encephalomyelitis. And that is something that we actually, they look back at the 1917, 1918 Spanish flu. There were also neurological issues with that flu. And in fact, there have been some cases where individuals who have passed, in the last decade or two, and who had survived the flu, they actually see calcifications in their brain, and they look at that flu being the factor of the brain issues. They actually also attribute Guillain-Barré symptoms or syndrome to COVID. So COVID is showcasing, it's triggering Guillain-Barré. And I don't know if you guys are familiar with that. But there is it's a neurological disorder. It can cause paralysis. It affects the nerves. It's an inflammatory autoimmune related element, and it can be very, very challenging. So this is something where there's so there's brain involvement and neurological. You see the nerves and all the nerve centers. And they talk a lot about just the impact on the nerves, the inflammation. They also show brain damage from COVID specifically. And some of that is because some of the milder situations either had pneumonia or didn't. Those with pneumonia, there was starvation of oxygen to the brain. So that's some of the impact. But then they also show COVID, the encephalopathies, which is an assessment of it's a septic situation in the brain, and it causes delirium and seizures. So we talked a little bit about that, the neuro-COVID stages. This also digs further into that, and they're identifying that the delirium is indicative of the septic encephalopathy. This is really concerning. And so for anybody who is like, oh, this doesn't affect anybody, or you'll just get over it. No, that's actually not what this is indicating. There are neuroinflammatory syndromes that they're identifying. And some of these patients actually have thalamic impact. So they start to see some of the different endocrine glands in the brain being impacted. So they see They show abnormal brain function. They show brain stem inflammation and infection in the brain stem, swelling as well. And then difficulty speaking. So we've seen that in the neurobrain. And then also we've seen some, they're showing the central and parasympathetic nervous systems being impacted, and there's embolisms that are also presented in the brain. So overall, what this is indicating is that there are an assortment of brain-related disorders. It's not just stroke that we're seeing. We're seeing a starvation of oxygen, so brain damage. We're seeing inflammation and nerve-related damage. Seizures are following suit, delirium, a loss of brain function. So this is going to be something that it will have a great impact also on other systems within the body, because the brain is the kind of control center. They actually, if you are interested in this and you want to look at this, they actually break out at the very end of this. They give you the images, but they also break out each of the different cases. And they talk a little bit about the case, what was presented, the age, the results, the clinical features like delirium, psychosis, reduced consciousness, large vessel stroke, cranial and peripheral neuropathy, painless weakness, seizures, myelitis, delirium, fluctuating confusion, cognitive challenges, dyspraxia, needing cognitive support, hemorrhaging, lesions, and this cyst-like lesions. That's very similar to what we see with MS. So I don't know if there's potentially some links there. But that is something to be concerned of, especially for any of us who have any type of family history of brain-related illness or neurological imbalances in the family. These could be turned on, so we might see some genetic elements at play. This doesn't go into genes or sequencing gene elements that might have gotten turned on. I'm sure that's going to be another assessment that we see and look into. Excuse me. But I wanted to highlight this because today's video topic, I wanted to dig into the brain health and specifically look at how can we support our brains to enhance our brain function, our cognitive function, increase our circulation to the brain, invigorate our brains, wake them up, improve and their function, but also lower the inflammation levels that exist in our brain. This is partly a potential preventative, just in terms of really fortifying your brain health, but also is very effective at supporting your brain and limiting any of these indicators in your own lives if you've had those challenges. This could be for folks that have seizures, hypertension with intracranial hypertension. So that is something I wanted to highlight. And I saw somebody likes my earrings, Brooklyn. These are on Etsy. I'll put a link down below on Instagram, but they're super fun. I'm honoring the toilet paper crisis. Oh, 2020. Yeah, we're still in 2020, the year I think we all wish would go away. So, and I do want to say today we have to give a happy birthday to my puppy dog, Mizuki, my firstborn puppy. She is 8 today. So Gabriel and I are going to cook her a special puppy cake. But most importantly, today we're talking about brain health. So I want to break out a few supportive supplements. I'm also going to share with you a what we call Focus and Recall. It's a neurological brain supportive nootropic. This is by our friends over at Healthiest, and they come in these great little packets. You can do trials of these or even a 10-day monthly subscription of these. So I've got a link down below, but everything I'm recommending individually is in here. And so this is a great way to bolster cognitive health and support the inflammation levels. But the number one thing that you can do to support your brain health is to encourage and enhance your omega-3s, particularly your DHA. DHA is very powerful at reducing inflammation, but it also supports brain tissue. The brain needs fat and liquid, so it needs hydration. So you want to be hydrated optimally every day, and you also want to get optimized fats, and this includes your steroidal omega or your D3. You also want to be getting your A's and your E's, but most importantly, DHA. We show a significant amount of studies that look at increasing the cognitive health and cognitive function of your brain. Then there is an Ayurvedic that I love, and it's called Bacopa. And that is a very powerful cognitive enhancer, a mental strengthener. It also supports memory, and it just really boosts your brain functionality. I actually like Bacopa over Go to Cola. That's another one that is powerful. But this Bacopa is something that we see in any of your good brain supportive supplements. That would be one of the core ingredients. And it is an Ayurvedic, so it's not always going to be something you easily find on a shelf. The other thing is an amino acid. Acetyl L-carnitine is an amino acid that actually helps the brain fire, and it helps it function. It helps get all those synapses and signals firing. It helps support the neurotransmitters. A lot of amino acids are very good for neurotransmitter health, but it is very powerful at enhancing your cognitive function. The other thing, and along with the fats, are phospholipids. And there's an assortment of phospholipids that you can add in, but it's definitely indicative that your brain, and we see the tissue. Let me see, let me get the images here. Where did my images go? Let's see. I have so much data to show you guys. Did I get rid of that? Oh, here it is. So in the brain function, all of these cells are made up of fat and water, and they lubricate and keep them supple and connected and energized. And we actually can see in some of these images, like this is craziness. Look at that. That's a hemorrhage. And so that can really, the phospholipids are very powerful at supporting and nourishing your brain cells, and enhancing their strength, but also keeping them supple and energized. The last one that I want to recommend, you guys know I love this, rhodiola. I drink it in my tea every day. Rhodiola is an adaptogenic herb that is very pro-brain supportive. And you'll find that a lot of the mental and physical stamina people need, it will be balanced by rhodiola. So rhodiola is great. Tons and tons of research. The Russians used it with their astronauts and their athletes, the Olympians, for recovery physically, but also mental. Like, it allows people better focus, mental capacity, cognitive function. Very, very powerful. Jingle All the Way says focus and recall is excellent. Yes. So this I want to talk to you. This is everything all in one liquid gel pack. And it's got a little kind of, they say it's peachy. I kind of get peachy citrus, but this would work really well if you want to do like a tea. You could add it in and mix it up. Or you can just take it by the gel. But I want to share with you some of the ingredients. So it has 5 parts to it. They have a focus and neurotransmitter blend. And this has magnesium. It has aerial parts of an herb called Pizia. It has L-theanine, L-tyrosine, and glycine. And then it also has the phospholipids for the memory, recall, and rapid learning. It has DMAE, which I love. And then it also has what they call a brain blood flow blend. And this is great because one of the things that they've shown with some of the brains is the impact, these 3 stages of the neuro-COVID. The second and third stages, there's actually a breakdown of the blood-brain barrier. So by taking curcumin, taurine, and there's a coffee robusta extract, which is a natural caffeine, that actually helps support and strengthen the blood-brain barrier. There's also antioxidants and adaptogens. So it has Asian ginseng, it has lutein from marigold, black pepper, and then we see the energy and the cellular fuel. So it has omega-369, it has medium chain fatty acids, so from coconut oil. It has 2 different B vitamins as well that are powerful. This stuff is great. So I've got a link down below for this if you want to check this out. But brain health, we are seeing significant impact with the brain. And what this also ties into what this Texas medical professor at Baylor, the med school professor, who's a clinician in the field. And what we're going to see are potentially, if you're in your 20s and you get COVID and you've got the lung damage, guarantee there's going to be brain impact. So there's a correlation in this study about some of the decrease of oxygen levels. So for like that young girl, the 17-year-old in where was she? Fort Myers, her parents finally took her oxygen levels and she was at 30 to 40% starvation in the brain. So we are going to see also, because of the way COVID's presented, a lot of people arrive to the ER, have no idea that they're on 20% oxygen or 60%. Anything below 92, 93 is in a red alert phase. Definitely in the high 80s, you need oxygen. And when we're dipping well below that, there will be long-term ramifications to our organs, the brain being one, the lungs obviously being a factor, the kidneys get starved, the brain gets starved, or the heart gets starved. So we see this cascade of layers of COVID impacting multiple body systems. And it wouldn't surprise me if we see, as we learn more, we start to pull all this data about all these different system inflammatory disorders, that we identify it as that, just like we see this in the children. They've quickly identified and labeled the disease that COVID impacts, multi-system inflammatory disease. This is very similar to how we're seeing adults presenting. And even though folks might not have pneumonia, full-blown pneumonia, or the major respiratory illness where they're going into the hospital, there's still damage within the asymptomatic lungs, which leads us to believe that they're going to be seeing scans like this. And we'll be seeing changes in the vascular structure, the vasculature and starvation of certain areas of the brain. This will impact how do people respond to, emotional situations. Is there going to be a high degree of PTSD from some of this? Are they going to have cognitive challenges in 20, 30, 40 years when they're in their elder years? Are we going to see a greater group of people coming down or having diagnoses of dementia and Alzheimer's? And if any of this runs in your family, it's a good idea to start using adaptogens and the phospholipids and the neurotransmitter fuel, as well as the nootropics. Those are what we consider the brain-related health supplements. The Healthy Cell, this microgel, is a great one single source where you don't have to run out and grab everything. But I wanted to highlight this because the brain function is definitely a concern of a lot of us. I mean, we can't function fully, optimally, and be healthy without our brain cognitive function being optimized. And that is going to, time is only going to tell, but we have predictors already in the damage degree. And if you followed Dr. Amen, a very well-known brain-related medical focused clinician who uses food and other healing aspects. We can heal the brain, but there's a certain degree that you can only do so much after the fact. So now is a good time to really support your brain function. And also for any of you, I know a lot of you have communicated in messages here on the chat, on Instagram, and emailed to me that you either tested positive, have family members who have. This is going to be critical that we start to evaluate. And it's not a bad idea for, I think, honestly, any COVID positive case should, at some point in the near future, have an appointment with a neurologist and have the right scans assessed to make sure they haven't had any unknown damage or any unknown impairments that could very well be impacted or addressed now versus later. So that's my communication for all of you. I don't know how much this plays into concern. Is definitely not fear oriented. I really want to indicate just all the news that were coming out. This particularly is big news in the world of brain, neuroscience and neurology, just how impactful. And we're seeing through the radiological scans just how much damage we're seeing with the brain. So, we hear the neurologist in Virginia, and we see now the UK, they're all saying the same thing, that there's a blood-brain barrier breakdown. We're seeing infections and inflammation in the brain, and we're seeing diseased brain, damaged brain cells. So it becomes really, really critical that we focus in on how do we support our brain tissue, just like we support and lower our, support our heart health, we support our vascular health, we lower our inflammation levels. Those are all things I've been talking to you about. I can't not talk to you about brain health. So this is my best resource right now for you, the Focus and Recall, to really support the nutrition you need for your brain. Okay, so I see a question. Give my body the best. What do you think about sending kids back to school in the fall? Are you sending your kid back? No, we are not. So we have Gabriel in a private school, and we have some contractual obligations that we have to work through, but he is not going to set foot in a classroom. One, it's a family decision we've made, and that's obviously personal. We have, Dad has a rare autoimmunity that if he gets exposed, we're already seeing in this rare autoimmunity, his platelet levels take a dive. His body attacks his platelets with anything, cold, flu, and it requires him to get IVIG, immunoglobulin, IV therapy, platelet transfers, infusions, and all that stuff. So we are really limiting that exposure. But because we're in a private school, they're flying in a different category than the public schools. And I know we're greatly privileged, and I am grateful for our investment in Gabriel's school. They do have a virtual option, and it sounds like a lot of families are heading that way. The school itself is opening up. I think it's 31 days to go. It's crazy. 31 days. School is planning on having a campus. They are rolling out all the steps and opening up the whole entire campus. We also have outdoor, they have a huge soccer field in front, huge auditorium. It's a infant nursery all the way to 8th grade school. So they have a lot of space, and they're actually using the space to and creating little pods, groups of pods, so that the kids don't engage with anybody other than their little group of people. It's 13 in a classroom. And then they have other programs that come into the classroom, but we still are not comfortable with the amount of contact. And also, there's just really our sense on the schooling is the greatest risk, honestly, are from adults. And so we see in our area just a lack of understanding this virus. There's a huge amount of COVID denial in our area. We don't see people masking up when we drive around, and we do, we're not going out to places. So we do see people that are nonchalant about this, and that will infiltrate the schools. But I think it also varies on your school system. It varies where you live, the amount of cases. There's just a lot as parents to take in. And then there's the economic component. I started my virtual side of my business when we moved here. So me working from home, not all the time, but definitely as part of my standard practice, just adding him at home while I'm here is a whole new category. But there are a lot of parents and I have friends that don't have that option. And so their only option is to send their child to school, and it's a risk. So there's a really good article. I want to say it's in either the New York Times or the Atlantic. Maybe it's the Atlantic. Or maybe the New Yorker magazine. But at any rate, there's a mommy blogger, a food blogger, who writes an article about like the challenge that parents have in this category. And Darlene says, both my daughters have decided to homeschool if distance learning is not offered through the school district. I see folks I know that have risk factors and they're teachers, and they might be dealing with young children. They have to change diapers. There's a fecal oral transfer that puts a lot of teachers at risk. And what are they going to be equipping them with all of this, masks and gowns? And that's a concern right now. Florida is not really rolling out a whole lot of guidelines other than mandating that they're going to be open. So we're going to see a lot of grief down in Florida. They're setting the tone. I forgot to mention, I didn't write it down on here, but yesterday, I think I mentioned either Monday, I think it was Monday or Tuesday. Let me look. I think it was Monday. Yeah, Monday I highlighted that Georgia Tech, the professors were writing, was it Monday? Let me see. Yeah, I think it was Monday. Georgia Tech professors were petitioning the school board, the Georgia University System Board of Regents, telling them that they weren't adhering to science or ignoring data, showcasing that they wanted not just faculty to be required to wear masks, but they wanted a mandate for everybody on campus, students, to wear masks in the classrooms to protect the professors. So the school board of regents actually sided with the 200 professors that signed the petition at Georgia Tech. And so that is going to be something that is telling. That's at the university level. We haven't seen that trickle down into every day. But if the universities are requiring masks from students on campus, more than likely we'll see that in the classrooms. And that is why it's now really important to get your kids different options. Like, these are disposable masks. You're going to have several a day. I mean, the reality is, what child is going to wear a mask? How frequently are they going to be taking them off, touching them? We really need to lay down some factors and foundation for getting them used to it. I mean, this is a high quality 2-layer. It's got a filter insert. This would be something if we go to his doctor's office, which we plan on in September for his 5-year-old visit. And that's really the only reason why we go to his doctor. That and, sometimes we do have shots, so I do stagger those. But he'll wear this, but he also needs to get used to this because he does not want to wear a mask. He doesn't like seeing me wear them. And so that's like a whole nother dynamic, is how do you get a 5-6-year-old in kindergarten, first grade to wear a mask? I mean, it's easier for a 12-year-old to understand it, but to also keep these on. And then if let's say they're in a Spanish class, are they able to speak freely while they're doing this? Do they need also, if they're doing speech therapy, they might need to have their mouths open and viewed by whomever is teaching them how to say and pronounce words properly. There's just a lot to take in. So, but it's also an individual choice, just like, how risky. Like yesterday, I highlighted the risk. If you didn't watch yesterday's video, please go back and watch it. This talks a little bit about the COVID risks. I break down the Texas Medical Association. I posted the link also. They break down risk categories. Guess what, friends? School is on here. Sending kids to school, camp, or daycare is a 6. It's right in the middle. It's right here, right smack dab in the darn middle of this. This is a 6 in terms of moderate risk. So sending your kids, so your child goes back to school, you're in a working setting, you've got, multiple layers of risk. And then if you guys go to an amusement park or, a higher risk, you're working on a gym, you've got multiple points of risk. So that is where this is such a great level. If you have to have your child in school, then really avoid everything in red and orange as much as you can, because you want to lower those risk categories. So maybe you're not taking your child, or you are getting your haircut or doing your normal hair salon visits. Maybe you're minimizing their football playing experience, so it's just these different categories, but everybody has a different risk factor. Our family we have high risk. We have a potential fatality that could occur if COVID happened in our household. That is known. Like, we know that. Many families don't and have kind of a detachment from that. And so that's where we're seeing like this 17-year-old, parents are tuned into the health and wellness world. Why they treated their child at home is beyond me. My sense is that the PA dad will probably end up being investigated by the state. It's just crazy. The thing they say is don't treat yourself, you're a family. So you're too close. You don't see things in the same way that you do when you are working with a patient, client, whomever. All right. So Loretta, hey, Loretta, I teach at a Florida middle school. I think we should wait for a vaccine before we reopen schools. And on the vaccine front, like we have, I think I just read there's 6 trials now in 3rd stage. And there's all the things that are in trial aren't just vaccines. There are the immunological aspects, the serologic, the antibody elements. And that is something like we love our school. It is one of the reasons why I would stay in Georgia. Because Gabriel School is so fantastic. It's so nurturing and just very diverse, and we love it. But one of the challenges, I think we have our UPS person here. One of the challenges we see is, and we ask, like, are you guys going to be testing the teachers? But even if they test the teachers and they come back to school, you have to test every day, and are you testing all the kids? And like, that is like its own issue. And already Georgia doesn't have enough tests to support everybody who needs tests as we're growing. I don't know. I don't envy the school administrators. I don't envy the leaders in the educational programs that have to make these decisions, because on these decisions will be risks and potential fatalities or links, contact tracing to other, high risk categories. So it's just one of those things that is really family specific, and families really, you have to have an in-depth conversation. And different parties and families have different views on it. Luckily, Brian and I, we're always like this in terms of like our thought process. But some are not. And that's like a whole nother issue, right? Like if your spouse doesn't support that, what do you do? So, there's just a lot. Steph says, how do you get the trial version? So I think it is a 2-day. I think there's an option on the website, but definitely check out the focus and recall. This is also good for anybody who feels like you're in a brain fog days. Part of this will affect some of the adrenal impact as well. Okay, so I've got a minute and 30 seconds left on Instagram, but I see a question. Give my body the best. I had to take my 5-year-old to the doctor and he hated the mask. Yeah, that's Gabriel. He kept touching it and trying to pull it off. It made me so nervous for what he might do during a school day when I'm around. Exactly. We kept saying, like, we had multiple calls with Gabriel's school, and we kept saying it'd be different if you were 8 or 9 or 10, but 5, they're still like, blah, 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 they're in their own little world. And Gabriel, yesterday when we were driving around, he's like, Mommy, they're not wearing masks. Those people are not wearing masks. The virus, they need to be aware of the virus. And we're communicating what is going on with him. My child is not going to be left in the dark. I'm not sugarcoating it, but I'm also not freaking him out. He just needs to be aware of why we wash our hands all the time. And that also is training. And so it's definitely something to start, encouraging the masking, but also do some reward systems. Seriously, I would treat this just like potty training. And we broke out M&Ms. That's the only time the kid has had M&Ms. I would do M&Ms. Let's see how long you can wear it. If you can wear it for 10 minutes, and that's a long time. Just get them comfortable with it. And the same angst a lot of anti-maskers have, kids have about it. All right, Instagram, head over to YouTube. I'm going to continue this conversation there. Thanks everybody for tuning in. See you tomorrow. Okay, so let's see. Okay, let's see. I'm going to share this. Sorry, you guys. My hour went by really fast. Okay, so I'm going to share that on Instagram. But so it's definitely a challenge with it's quite a challenge with kids. And Cupcake Paper says, I think special ed rooms all need sinks. They should have them. But again, like my friend that's she's in this younger special ed. There's definitely a risk factor. And how do you also communicate to children that might not understand the consequences of touching their eyes and their nose? I mean, like kids 5 years old, they're picking their nose all the time. I mean, Gabriel's like constantly up there. I'm like, oh my God, please stop. So it definitely is a factor. Let's see. Violet, it's unfortunate that people would have to deal with this, but one silver lining is that it will bring the spotlight to ME/CFS. Yes, absolutely. And thanks everybody for the thumbs up. Please hit me a thumbs up. I appreciate it. What do you see that is different when taking focus and recall? Okay, so Alyssa, generally this has much increased energy, focus. So concentration, mental acuity is seen. Also, folks that have had some headaches, I will see improvement with this, partly because they're getting the brain nourishment, the anti-inflammatory related brain nourishment. That might be one of the headache triggers. Also, you start to see a better capacity of other organs and glands functioning. So, the control center, when we start to decrease the inflammation levels of the brain, we actually see our hormones balance. We see also neurotransmitter health improve. So there's a lot of good benefits with this, but definitely the mental acuity is, so lack of forgetfulness, you hit that like 1 to 3, 1 to 5 p.m. lull, or you're like, can't remember something. I've noticed that, like my recall is not as great when I don't take that. So that's what I generally see. And this is newer on the market. So this is the latest product that they have out. And it's fantastic. Okay. And Mom to Max and Angie says, I have focus and recall on auto ships. It's amazing. Yeah. And Mom to Max and Angie, please feel free to comment if you have any specific things that you've noticed. Loretta says, my dad is in an Orlando hospital. Oh, he's 81 with multiple risk factors. He is on 100% oxygen. Does that mean his next treatment is intubation? So does he have COVID is my question. What they're finding, so if he's on oxygen, why is he on oxygen? If you can, what they've found is that prone position. So tummy lying really improves the function of the lungs. And so if you have a call with the doctor, find out if they can get him prone. And they can even ventilate on prone, and that does improve the oxygen. So that would be something I would ask. Steph, my force of nature electrolyzer does not show any light anymore. I cannot make a solution anymore. I sent a message. Okay, so Steph, email me directly, and I'll forward it on to my, I communicate a lot with the owners. So email me and I'll get somebody to get on that ASAP. Sometimes customer support, goes to somebody that might be passing it on to somebody. So there's sometimes a delay. So many people thought the higher temperatures during the summer would slow down the virus. Yeah, there were people who thought that, but that thinking comes with like the flu assessment, and it's not the flu. The idea that it might slow down was that maybe people would be outside, and we do see a lower transmission rate when people are outside and social distancing. So for instance, the data right now on all the protests, a lot of people were masked, but there were some people who weren't. But we're seeing minimal spread from the protests. And I've had people comment on my videos, well, the protesters, well, unfortunately, we're not seeing that. But we are seeing it in enclosed spaces. We see it at, birthday parties, home parties, churches. And my concern is we're going to see it in the schools. We see it in the prisons. The prisons are, I didn't even report this, but the prisons are just blowing up. There's San Quentin, I think, in California, that is like a really bad hotspot. They had no cases, and they transferred in patients from other prisons, and they've just spread, like there's like 1,300 people. He does have COVID. Okay, so Loretta, I would ask prone. Ask them if they are doing that, and ask them if they can, because with him on oxygen flipped over, it allows the lungs to drain, and they see a better increase. Now, the clinicians, they're aware of it, whether they're employing that, just see if you can encourage them, that'd be great. So does intubation mean it's next? That is one of those things. I don't know what the threshold is. And every hospital system has a little bit of a different protocol, I know, when it comes to this. But if, the thing that I would look at is, how do we increase those levels? The challenge too is that we're not able to be with our family, and it becomes really challenging because you're trying to communicate while these people are overloaded. And Orlando is definitely seeing spikes. So you're limited in being there. You're limited in getting, really monitoring everything that's being done, but definitely prone position. See if they can dig into the prone. And I'm trying to remember, this was early on, like some of my early videos. The other thing too, if your dad's awake and you're able to do any type of video, have him practice productive coughing. I have a whole video on it. It's shorter, so maybe you could have him watch it. But literally, like, depending on how his function and capacity, but if he can tuck his arms in and do a few deep breaths and then cough from way lower, like diaphragmatic type of coughing, that can help expel and break up some of it. Because what you're seeing is a lot of this like lower, all layers of the lungs, but that lower region is getting impacted. But definitely prone position. Hugs and prayers to you and your family. I know it's so, it's just so unnerving, and you feel completely lost and disconnected. But no, these clinicians, the ER, ICU, they are doing the best that they can, and they are the ones who are trained for this work. So, okay. My mom has diverticulitis. Would it be safer to take the focus and recall? I believe so. I don't see any reason why there's nothing in here that would aggravate diverticulitis. Lung clearing. Yay. Okay. Thanks, Christine. Yeah, the lung clearing. I have a whole bunch. I've got a lot of video content up in here that I need to get out. I just don't have a whole lot of time to even do that with our scheduling. It's the dilemma. Okay. So, all right, friends, I've got to run, and tune in tomorrow. We'll see what comes out in the news tomorrow, but I definitely want to, there's more topics that I want to talk about this week, but definitely please consider focus and recall, just overall brain support, especially if you have any family history of dementia or Alzheimer's. Those are terrible diseases. And there are ways to manage that. And also there's a gut brain connection. And that is something I need to do a video on, because there will be people who are recovering that may or may not have access to PT and other therapies. We can invigorate the vagus nerve by very simple activities you can do at home. That's more for like an edited video, but I'm grateful for your time, Pat. Thank you. Thank you for being our moderator. For all of you who love this content, please give me a thumbs up. And if you do me a favor on today's video, when I end it, it sometimes takes like 5 minutes to kind of articulate it, but will you go back and comment on the main video? That seems to be one of the best ways this blows out into beyond just our viewers and gets out into the YouTube sphere. So I really appreciate that. Liking and sharing the video is also helpful. So let's get our message out. Let's keep people healthy and safe. And I appreciate your community that we're creating, and for Pat being such an awesome moderator. I know yesterday was a little crazy. All right. Thanks, everybody. Have a great day. Be healthy and safe. Bye, everybody.